Hi everyone, my name is Amanda Evans. This is my first YouTube video ever. I'm gonna make it pretty quick. I don't have a lot of room on my phone right now. I'm trying to get more gigabytes, but I'm just making this video to help women or men, I guess, decide and help with research on breast augmentation. So I am getting my breast augmentation in less than 2 weeks. I'm pretty nervous, pretty excited. It's been a really smooth process so far lately. I've done a ton of research, Reddit, Instagram, Facebook, YouTube, lots and lots of videos, lots of before and afters. And me being me, I look into, go lay down. I look into pros and cons. So, one of the things that I really kept in mind is a lot of people said that they didn't go big enough. So, I am getting 485 cc's. Now, I'm starting off as about a 34B. So, that the doctor said that would put me at a full C, small d. And that's really what I'm looking for. And then silicone versus saline. So saline is salt water, and it's in it's in the implant. And then silicone gel is a cohesive gel that's also nicknamed as gummy bear. Take gummy bear, you cut it open, nothing falls out of it. That's what this gel is. That's what this implant is. So go bigger is what was really drilled into my head. Is go bigger. So my first implant that I tried on, just in a bra, was 425, and I pushed it to 485. Now, I pushed it again to 525, and that was just too much. I liked it because it was like, whoa, I got boobs, but I really had to reel it in. 485, it's more practical, more natural for me. And I mean, I would consider it an invasive procedure. So my doctor talked to me about two different incisions. So there's an incision around the areola, and there's an incision that I could have gotten under, like right in the crease of the breast. I chose for the areola. It's obviously a darker area, so scars may or may not show up easily that way. I am happily married, so my husband is the only one who's going to be seeing that scar, so that really doesn't bother me. And then what they do is that, yes, they fit the entire implant through the incision in the nipple because they use something called a Keller funnel. I would recommend looking that up. I saw a really cool video, and that's what really sold me on the incision in the areola. Now, a big thing to consider, and it's something that I've been kind of stressing over the most. I wouldn't say stressing, but it's been, coming to mind the most, is post-op. So I am a veterinary technician. I hold and wrestle cats and dogs all day. Sometimes some dogs that weigh more than me. So there are days where it can get, a lot of manual physical labor. Now, I cannot lift anything over 15 to 20 pounds for 4 to 6 weeks because the implants are going under the muscle, under the pectoralis muscle, under your pecs. And so any kind of resistance, you're using those muscles. When you use those muscles, it can push the implants out, which makes a bad shape to your breast. So, I mean, there are some cats that weigh over 15 pounds, so I really, really have to practice delegating. I can help, but with, at minimal stuff. And my job is very accommodating for it. So incision, saline versus silicone, and it's not, and post-operative time. Now, I have a list of medications that I am not allowed to even touch or look at. Well, I mean, I can look at them, but there are a list of medications I cannot take 2 weeks before and 2 weeks after, minimum of 2 weeks before and after my surgery. A lot of it is acetaminophen base. And it says because aspirin, ibuprofen type medications, as well as vitamin E, certain herbal medications, blah, 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 increase one's bleeding tendency. So I guess it lasts for that long in your system. I can't really quote like the medical side of that. But there's a lot of medications I cannot take. I actually have to be off my birth control. And then I cannot have any energy drinks. They will have me take a pregnancy test the day of, and if that test is positive for some strange reason, my husband and I don't have kids, we never plan on having kids, then they obviously cancel the surgery and they keep a large percentage of the amount that is now paid in full. So they take that obviously very seriously, and also you cannot smoke for like months. I'm not sure about the time frame, but I know it's months and months before and after surgery. Whatever the anatomical reason behind that is, they go through everything. They go through how you're going to quit, what you're going to use to quit, how long you're going to quit for, and when you start back up, and like all that jazz. So so for my consultation, I literally went in with a list of 22 questions. And that was after I did months and months and months of research and answered some of my own questions. Now, my doctor and the nurse were more than willing to answer my somewhat ridiculous questions. If for any reason you feel uncomfortable asking these questions, or the answers you get are like, yeah, but see, I don't work with that every day, so how the heck am I supposed to know that? If they ever make you feel that way, then you know what? There are plenty of other plastic surgery centers around. And that consultation cost me $50. So me being me, if I was uncomfortable enough after that consultation, I'd be like, all right, keep the $50. I'll see, I won't see you later. And the other thing is, day of surgery, you have to have someone drive you. There, might be a hotel near the clinic, near the plastic surgery center or something like that. But you need to have someone drive you. It's a slightly invasive procedure. A lot of doctors recommend very strong pain medications. You cannot drive after you've been through all of that. I was told that all in all, between getting there, the procedure, and recovery, it's going to be about 3 to 4 hours. Which honestly, if you think about it, that's not a lot of time to almost cut you open, put a foreign body in there, sew you back up, do it all sterilely and professionally, and then wake you up and get you out. To me, that's not a long time. So just ask a lot of questions, and I even did research on what medications, what pain and antibiotic medications they're going to give me, and even anti-nausea. And then I called pharmacies around me, and asked how much it was for the milligrams and the quantity that the doctor told me that they were going to give me. So just really do your research, make sure you're comfortable. Now, personally, I am not self-conscious. I was never, ever made fun of for having like a flat chest. I'm a 34B. I'm not flat. I'm not voluptuous. I am very happy. I wear very padded bras with underwire. I'm happy with that. It's just the idea came across my head. We were saving, and then we had the money in the savings account. So, Mila, Parker, no. Sorry, Dachshund Trading. So do it for you. Don't do it for him. Don't do it for her. Don't do it because someone said such and such a thing. Do it for you. I would be perfectly happy with my 34Bs for the rest of my life. But like I said, the opportunity came across and I'm more than comfortable, changing my body this way. I hate to say it, but I'm almost 30. Well, I don't hate to say it. Honestly, I really should be saying I'm almost only 30. Just kind of trying to be positive like that. So I had to make this video really quick. Sorry. So please like my video, subscribe. This is the first time I've ever made a video. Hopefully it all goes well. If you have any questions, please comment. I will be uploading more. So I'm about 2 weeks out from surgery. Woo! And I will be uploading closer to my day of surgery. and then hopefully after my surgery, if I'm not too like groggy and out of it. So thank you for watching, and it's my first one ever. If you have any questions, comments, anything, leave them here and I will be sure to read them. Thank you so much, guys. Bye.